Good afternoon, everyone, and welcome. This is Atrium Health's Return to Work Town Hall Part 3. My name is Ruth Christopolsky. I'm Senior Vice President of Population Health for Atrium Health, and I am honored to be here today with each and all of you to discuss how we return to work safely in light of COVID-19. And how we prepare our workplaces in order to do that. Today's agenda is interesting. We're gonna switch things up a little bit. We have a question and answer session that we're gonna lead first. We're gonna talk a little bit around best practices for managing exposures in the workplace, and then spend a little bit of time talking about how Atrium can help all of you as you prepare your return to work. I wanted to let you know that today's meeting is being recorded and will be available following the meeting. You will all receive access to a website, so you can share the meeting recording with teammates or others in your organization. In addition, today we do not have the capacity to manage a live chat, but as we're speaking, we are taking questions at COVID-19rtw@atriumhealth.org. So as we're chatting and presenting, if you want to ask a question, please send your question to COVID-19rtw@atriumhealth.org, and we will make sure we address as many questions as we can at the end. For those questions that we're not able to get to, our team and our clinical teammates will ensure that we respond as quickly as possible after the presentation. I would like to introduce to all of you Dr. Louis McCurdy. Dr. McCurdy is our Specialty Director for Infectious Disease. And he has graciously agreed to allow me to question him on some frequently asked questions that we've been receiving from employers around the region. We've collected these questions. They're the ones that are asked most often over the last 2 or 3 weeks. And so thought it would be a good idea, instead of presenting, asking your questions to Dr. McCurdy. So Dr. McCurdy, are you ready to answer some tough questions?
I am ready.
All right. So first and foremost, we're hearing a lot about testing in the media. We heard some testing recommendations by the head of the North Carolina Department of Health and Human Services. So wanted to ask you, can anyone receive a test for COVID-19? Who wants one?
Yeah, I might have said I was ready too early. This is one of the tough ones. So we're starting off with one of the challenging questions that everybody wants to know: if can they get a test or not. So I think that the answer is depending on who you talk to, and I think actually what I would like to talk about is, what's the value in getting a test. So I think as we've expanded testing across North Carolina and across the country, one of the things we talk about so often is, can I get a test? And is a test for everyone? So if you're listening to Donald Trump, the answer is that everyone can get a test, that a test is available to all of us. And I think we are getting to a point where the availability of test is greater, which is fantastic. And I think has brought us a long way in understanding and managing this pandemic. But I think the real question is, why should we be getting a test? And so to your point, Ruth, last week, the North Carolina Department of Health did expand some of their comments about who a test was appropriate for. And I think some of the expansion was certainly appropriate and in line. And I think the main thing we want to do is make sure we have adequate testing for people who are sick. And so I think, as I think about this and how we manage the COVID pandemic, is we do want people who have symptoms to have access to test, and we want that access to be easy. So I think one of the main things for people who are sick is that all of us, whether we're at home, whether we're at work, or where we might be, the best thing is to separate yourself from who you're around and to seek help. So we've talked about this on some of the other forums, is most of this can be done virtually. So you can be at home, you can call the Atrium hotline and talk to someone about your symptoms, and then get testing access that way. I think one of the things that this is alluding to is there probably are other populations of people who have high-risk diseases, people who've been exposed, whether that be at work or in some other community space, that they need access to potentially to testing because of that exposure. And so that is one of the things that the North Carolina Department of Health expanded upon last week. And I think it's something that at Atrium Health, we're trying to incorporate specifically for people who've had an exposure so that we can get those people appropriately tested to make sure that they may not be an early infection or someone who may be asymptomatic.
Well, thank you for that answer. That was very thoughtful. Can you talk about kind of the impact of having a test if you don't need one and you weren't exposed? I'm a general person, I want to be tested. Can you talk about why that's probably not a good idea?
Yeah, so a great question, sort of in follow-up to one. So what we don't want to do necessarily is test people who don't have symptoms. The challenge with this is that we don't know exactly when someone might develop symptoms after an exposure or develop symptoms without having a known exposure. So if we just randomly test people, we're really getting just one point in time. And so it's like saying, test me for cancer today, but I might develop cancer next week. And that you can say, well, golly, I got tested for cancer last week and you told me I didn't have it. And so very similar with this, if we don't test at the right time, or we're testing people who don't have symptoms, that test is really only good for that moment in time. And so people can have been exposed and then go on to develop symptoms. And if we test too early, or we're testing not at the right time based on sort of viral dynamics and viral replication, then we run the risk of telling someone that they're negative, who then may in fact go on to develop disease. And so that's important for several things. One is it gives a false sense of hope. In the sense of someone says, oh, I was exposed and I didn't get it, so now I can go about my business. Where in fact, having a negative test after an exposure shouldn't change how someone behaves. And so the guidance would be to continue to self-isolate during the window of 14 days so that we aren't exposing someone. And so that really sort of gets back to, why would we just randomly test someone who doesn't have a symptom or have a need to be tested? Because we're really not achieving much in that sense. Whether we're getting a false negative, as some would call it, because that person, isn't truly infected at that point, or that we give someone a sense that they don't have it, but they could go on to develop symptoms.
Thanks so much. And now we know a lot of our employer partners are thinking about managing return to work decisions, particularly return to work decisions for individuals who might be exposed. Can you talk a little bit about how employers can access testing for their employees and the access points that we have at Atrium Health?
Yeah, so again, I think targeted testing for some folks getting back to work makes some sense. And so there's, I know we're going to talk a little bit about different types of tests as we move forward. But really right now, we think the one type of test that sort of helps clear someone, if we want to use that word, or help guide someone getting back to work, because I really don't think there's a true clearance, as I sort of alluded to in some of the previous comments. We do have ways where people who have been potentially exposed and need to be evaluated can access our Atrium COVID hotlines. We do have the ability for people to access their providers, who then in turn can help direct people to testing. So again, most of this testing can be done in sort of a sort of virtual world where we don't need people getting to emergency departments or urgent cares to sort of access this sort of testing, but accessing through our virtual points of entry. We can direct people who we feel are appropriate for testing. And again, I know Nicolette's going to talk a little bit later about sort of what those windows would be after exposures. But we're talking within 4 to 7 days after an exposure where someone might be appropriate to get tested as one of the points in sort of evaluating someone as far as getting back to work. Again, that sort of exposure management timeframe is a little bit different as it relates to a true exposure and getting someone back, but we can potentially use testing as a tool for people to evaluate whether their symptom could be COVID related or whether their exposure could have been an exposure that caused them to be ill.
So I'm a person, I was exposed. You're saying that testing probably should be somewhere between 4 and 7 days. If I test negative but show symptoms a few days later, should I be tested again? Would you suggest that people be tested again?
Yep, a great question. So yes is the simple answer, and then to sort of develop that a little bit more, again, as we sort of talked to the first question, the main thing that we want to trigger are symptoms. So again, if someone were exposed, we know that the average sort of incubation time after exposure is somewhere around 2 to 7 days. The reason we say 14 days for isolation is because we know that that exposure can take longer to develop, and so that's why we have that window. So again, you wouldn't have wanted to be exposed 2 hours ago and then run out and try to get your test, because we know that the virus wouldn't have time to sort of infect you into a place where if we did a nasal swab that we'd be able to find the virus. And so sort of the optimal window is not known for sure, but we know somewhere around that time frame is when most people do develop symptoms, and we know that testing is more valuable when someone has symptoms than when someone doesn't, just because we think that the viral load or the viral burden would be greater at the time of symptoms than when someone's asymptomatic. And so if you test too early, someone may not have symptoms, or again, to your point, if we tested at day 4 and then at day 6 someone had symptoms, even though their test at 4 was negative, we would want to retest that person to make sure that these symptoms aren't reflective of the infection and then we missed it with our earlier testing. So I think symptoms, to your point, are key. We've talked about these symptoms before. They're sort of classic symptoms, right? With the fever, the cough, the shortness of breath, but we recognize some people can have more subtle symptoms as well. And I think that's something that we've tried to educate certainly our providers and our patients through our tools like the bot tool and others, and trying to get out into community as well, that some people may have symptoms such as a sore throat or worsening headaches or loss of taste or smell that have been associated with the COVID-19 infection. And so anytime someone develops symptoms, that becomes important, and we would want to consider retesting those people for sure.
Well, thanks for that thoughtful response. I'm going to now bring up one of my very favorite topics that I know causes the hair on the back of the neck of a lot of our clinicians to rise. But really would love to hear your thoughts on antibody testing and its place and utility as we're thinking about bringing employees back to work.
Yeah, so this is another one of the tough questions, and sort of just general thoughts could be many. And just to sort of lay out the sort of foundation for antibody testing for folks on the call, antibody testing basically is looking to see if you've developed a protein that suggests that you're having an immune response to the viral infection. And so with different infections, our natural antibody responses, timing and development can be very different. But just sort of from a science perspective, we tend to develop 2 main types of antibodies, an IgM antibody and an IgG. We do have other types of antibodies, but just sort of for the basic framework, those are what's important. And the IgM antibody is what typically develops first, followed by an IgG antibody, which is one that tends to last more of a lifelong for certain illnesses. The trouble with the COVID-19 virus is that right now we honestly don't know what antibody means. And so when we say that, we obviously know in the context of antibodies in general what that means. But what we don't know is always who develops antibody, when exactly that antibody develops, and to what extent. And so there's obviously knowledge out there, studies that have come out of China, studies that are now coming out of the United States and other countries, where we know in general when antibodies do develop, both IgM and IgG, and we think those are within a week, 2 weeks, typically for most patients who are infected, but they do vary from one patient to the other, which makes it somewhat difficult. And then the thing is we don't really know what that means. And when we say we don't know what it means is we don't know what level of antibodies give protection. We don't know if there is such a level that protects people from getting infected again. And we also don't know how long that antibody might last. And so it creates some challenges when we're saying get this test to sort of evaluate yourself. And so the challenge is, well, what are we truly evaluating? And the other challenge is that when the disease prevalence, which is how much disease we have in the community, is low, oftentimes a positive test can be what we call a false positive, meaning that you actually don't have antibodies to that viral infection. And so that also adds an extra layer of confusion, I'll use that word, as we interpret antibodies in current day. So if you're in an environment like New York, where the prevalence is much higher than it is in North Carolina, antibody testing for folks who might not have had the opportunity to have the COVID testing or might be seeing if they developed antibody might have a different sort of angle to it than we would see here in North Carolina. There's been some studies that we're participating in with Wake Forest, where we're looking at community seroprevalence, and Atrium Health will be rolling that out here in the Charlotte area and surrounding counties in the next week or two, where there's some people doing some at-home antibody testing. And then at Atrium, we also do have antibody testing that's being performed in the laboratory. And so again, the point there is there can be some difference in these antibody tests, differences in how they're done, and also differences in what they tell you. And so all this becomes a real challenge as we try to understand what these tests mean and how we can use them in which context. And so maybe I'll pause there and see if you have direction otherwise with the questions.
Yeah, I do. I mean, we're talking about antibody testing, and I almost feel like I'm a testing expert because I've done a lot of reading and have gotten a lot of tutelage from both you and Dr. Passaretti and from Dr. Lippard, who leads the lab at Atrium Health. And we understand, at least we're hearing in the media, about the sensitivity and specificity of testing and whether they're good or not. Can you explain to us what sensitivity and specificity means in relation to antibody testing? And then could you give a little background on the test that Atrium Health is using and the specificity and sensitivity of that specific test?
Yeah, sure. So these terms, sensitivity and specificity, are real important because they basically tell us how good the test is at picking up people who have the disease, which is more of the sensitivity piece. So how good can I, if you had the disease, will my test pick it up? And so the higher the sensitivity, that means the more likely we are to find a positive test for folks. And then when you look at specificity, that's sort of the other side of things, where if I tell you that you have the test is positive, how good is that in telling us that answer? So is it specific for that disease process? And so we want both of those numbers to be high because we want the test to be performing well. And so we don't want to have a lot of false negatives, meaning that someone has the disease and our test is telling us that you don't. And we also don't want the opposite, to where we know where people had the disease and the test is telling us that you didn't. And so those are sort of the downsides to a low sensitivity and a low specificity. And so you want your test to be performing well. And so that's one thing that's been in the media about these tests and how good are they picking up disease, which is more the sensitivity, and then the specificity is how exact are they in telling us that we have it. And so at Atrium Health, we've taken a lot of time, Dr. Lippard, to be, again, not certain, because I think with everything with COVID-19, there's lack of certainty, but trying to make our test as good as possible so that we can give people as good of information as we can about their test. And so we have the test platform that we're using right now is Abbott. We continue to evaluate if there are other platforms that are better. And with our test now, we're in the mid to upper 90s for sensitivity, and we believe close to 100% or 99% in specificity. So that really gives us good performance when we're looking at folks that are getting tested at Atrium. The other thing that we are doing as we roll this out, we're trying to internally validate some of this information. And so again, the platform that we chose has some characteristics that we knew about before even bringing it to Atrium, but we're also trying to make sure that that information coincides with our local information as well.
So thanks for that. Can I ask a real basic question just for some folks out there who may not know? I had to find out. So we know that the traditional test for picking up COVID in a symptomatic patient is a nasal swab kind of procedure. How is the antibody test done?
So the antibody test or our blood test. And so it's a great point. So some of the antigen tests or the PCR tests that we talk about are mostly through the nose. Some folks are hearing about oral samples and salivary samples as well, which are being looked at as options, but the antibody test is a blood test. It takes a blood sample. Some of the at-home tests can be done with a simple drop of blood or a phlebotomy sample, just as you would for a blood count or a kidney test or some other blood test that you might do at your doctor's office.
Thank you. I know, like many other folks that are on the phone and our employers, I've been inundated by the number of people who can do testing for me. Places I've never heard of, and I've worked in healthcare for almost 30 years. And I know that the FDA put some additional requirements around testing. Can you tell us what it means if a test has received emergency use authorization from the FDA? And is it important to use tests that have either FDA approval or emergency use authorization?
Yeah, so this is another sort of heated topic in the media as we all became sort of inundated with these tests that were available to us, tests you can order online, tests you could get at this doctor's office or that one or this healthcare system or another. And so emergency use authorization was created by the FDA for multiple things around COVID, including therapeutics for drug use, but as well as testing. And so it basically means that it's gone through a review of the FDA, and there's some companies that have put out tests that aren't EUA approved. And the FDA made a real concerted effort over the last few weeks to sort of set out guidelines for companies developing antibody tests or antigen tests, which is the other thing that's been in the media, to try to put a little more scrutiny around the performance of those tests. And make sure they're validated so that we can try to give people as good of information as possible when people are seeking information around this. So to your point, it is important to be using a test that is EUA by the FDA. The Atrium test that we are using now for antibody testing is approved by the FDA under EUA. And so that is something that people who are seeking tests would be important to make sure that they are getting, again, not necessarily a validated test because that's sort of an approved FDA test, but a test that has been evaluated by the FDA and has undergone some scrutiny to make sure that it's appropriate for use.
Wonderful. So here's a question. We know that there are some individuals that have been COVID positive. Once that person is cleared and returns to work, do they need to follow the same protective guidelines as those who have not yet been exposed? What's your recommendation for somebody who's had the disease and is now re-entering either the workplace or the community?
Yeah, so I think it's important right now, since we're all still learning, that everyone behave the same. So what we don't know, and we think I alluded to it with the antibody test, is we really don't know who's protected. As this pandemic evolves, right? I mean, we're still 5 months into this. If it sounds crazy because it seems like eternity, but this is all still very early. So we're trying to learn as people do recover and re-enter workforces and re-enter to their normal daily activity. What does that mean? And so our hope is that people who've experienced this infection and recovered after a period of time, that they are protected moving forward, but we don't know that right now. We don't know if people can get reinfected. Some of the data suggests they can't, but I think the wisest thing to do right now is for all of us to continue to sort of practice the behaviors, whether that be at home, out in the community, or at work, that we've all sort of learned to adapt over the last several months. So again, I think that means wearing masks where appropriate. Hand hygiene is super important. Social distancing remains important. So whether you've experienced the illness and recovered or not, the same sort of guidelines about behavior, I think, is still important for all of us.
Thanks. And so I'm going to ask the final question. We had a little bit of a conversation before we started today about the state of North Carolina, and as we're easing restrictions, and we know in South Carolina those restrictions have already been eased. Do we still believe that it's advisable to have individuals continue to work from home? And if so, why do you believe that?
Yeah, I think it's still super important, actually. So, I think we've obviously all experienced a lot over the last couple months, and we're all eager to sort of get back out again, and enjoy not only the weather, but enjoy sort of socializing again. But I think this disease is still quite early. And so again, sort of looking at some data across North Carolina, whether that be in the Charlotte area or other areas, we still feel like the disease prevalence or the amount of disease in the community is low compared to other areas for sure. And so I still think it's super important for people to sort of be as separate from each other as possible. So, and I think that includes working from home and virtually where possible. Certainly social distancing is super important when people are in environments together. We sort of say, 6 feet apart from each other. But I think where we're able to maintain our distance, certainly in work places where we might be in tight quarters, I think it's super important. I think we continue to see in the community areas where people are working together, where essential workers may be working, where people are getting into smaller environments and spaces, where we can continue to see spread of the disease, particularly in those environments. And so I think as a community where we are able to continue, where there are people who are able to work from home or work in different spaces virtually, I think it's certainly important as we continue to sort of march through the next few months.
Well, Dr. McCurdy, as always, that was very informative, and I always learn something new. So thank you for your time today. I'm going to ask if you want to stay on the line in case we have questions at the end. So thank you for your time and for your leadership during this challenging and unprecedented time.
Sure. Thanks for having me.
Sure. So next up is Nicolette Davis. Nicolette is our Assistant Specialty Medical Director for Occupational Medicine. And Nicolette's going to talk to us about worksite exposures and best practices on how to manage those. So Nicolette, I'm going to turn it over to you.
Wonderful. Thank you, Ruth. And Dr. McCurdy is definitely a tough act to follow. He has done such incredible work with his team 24 hours a day, 7 days a week. So thank you again, Dr. McCurdy, for your knowledge. We appreciate you as a team. I do want to start off with saying that our current guidance today, what you hear today, and I'm sure you've heard this on other town halls, is that this information changes by hour, by minute. The slides that I had prepared for you all at the end of last week actually changed as of probably 8 o'clock this morning. So please know that we are looking at local, state, and national guidance and trying to come to you with the most updated information. And when we need to, we're pivoting and shifting and coming up with the right process to take care of your employees. What I want to talk about first is worksite exposures and give you some kind of action items to look at whenever you're trying to avoid a workplace exposure to COVID-19. A couple of things that I want to share with you are actually direct cases that I've heard about and helped manage. So one of the big things that we hear about are exposures that occur because maybe there are groups that commute together, or they are in work trucks together without using any kind of facial covering. Some other items that we've heard about are maybe people who work in a closed and confined space, sometimes in plants where they have to work together in a tight space, but there are multiple employees working definitely less than 6 feet away from each other without face covering. Also, just looking at when large groups are going to have to be indoors again. How are we separating those spaces? How are we identifying where a risk might occur, and how could we prevent that by potentially having workers either do split shifts or having workers separated by a distance? So these are some things that can be actioned on quickly and some things to just be thinking about along with your workers that could have high risk medical conditions that voluntarily disclose these conditions to you. This is great information for you to have, especially if you can accommodate job restrictions or putting them in a different job position or actually having them work from home like Dr. McCurdy had said. Also offering personal protective equipment when you can. Some other things that we can do are we can screen employees each day before they arrive, and we're actually going to talk a little bit more about that and what we have to offer you. Requiring appropriate personal protective equipment for your employees when you have access to that. Making sure that your employees know they need to wipe down their workstations and work vehicles before a shift and after a shift, and giving them the appropriate wipes to do that with. Having a cleaning staff that you know is going to wipe down high touch surfaces, at least at a minimum, before a shift and after a shift, and if not in between when possible. Looking at your break rooms and how they're organized. Having those break rooms not be a socializing area for your employees. Maybe even restricting to 2 employees in the break room at a time. And also having your employees bring their own utensils and plates so they're not reaching into a drawer and touching something that someone else had their hands on. Some other ways to help avoid worksite exposures is to really encourage your employees to stay home if they've had any known exposure to a COVID-19 positive person, whether it's in their household, a friend, or an employee contact. This could be a person who's under investigation, or it could be a person who is a known COVID positive. So definitely making sure your employers are aware that you really want to be in the know when something like this happens so that you can make accommodations for them to keep them safe and to keep their coworkers safe. One way that you would do this would be to have that person self-isolate at home in self-quarantine for 14 days prior to returning to your work environment if they were exposed to someone who truly had COVID-19 and were positive. So that's definitely the recommendation. If that person happened to be negative, the person under investigation for COVID was negative, then your employee can return back to the workplace. But you really want this to be a conversation that's constantly ongoing with your employees so they know they can always come to you and identify when they could have potentially had an exposure. This is really important to keeping your workplaces safe. Now let's shift gears a little bit. Let's talk about what are you going to do when a workplace exposure has occurred? You know, right now with the prevalence of COVID-19, it's not if it's going to occur, it's when. So we need to be prepared and we need to know that we have the resources to make the right decisions when it comes to which patients do we need to, or which employees do we really need to focus on that need to be monitored. So when we look at the CDC and what the definition is of a close contact COVID-19, we have a couple things that we're looking at. First, we're looking at distance. So if you have an employee that is positive for COVID-19 and you have coworkers that were around that employee during the time of becoming positive, then what you're looking at to define a close contact would be any of those employees that were within 6 feet of that COVID positive person for greater than 15 minutes without a face covering. Those are considered close contact. Now, the other side of this is actually having that unprotected direct contact with someone's secretions or excretions, the person that had COVID-19 and was positive. So we're talking about being coughed on, sneezed on, or touching the person's bare hand or touching a tissue that the COVID positive person had touched. That's the definition of close contact. So those that have close contact with a COVID positive person need to be put under investigation, and they need to be monitored and surveillance. So what does that look like for you? So what would happen is that the coworkers that you have or the employees that you have that fell under that close contact definition should really be sent home for 14 days. Now, there is a recommendation which Dr. McCurdy did allude to. This is actually the part of the presentation that changed last night and early this morning. So now the recommendation is to PCR test or nasal swab test any employee that fell under that close contact definition. We're recommending that this swab be done for the same reasons that Dr. McCurdy had mentioned earlier, between days 4 and 7 due to viral load. We do recommend this be done, and this is hopefully to help prevent or help to monitor these people if they were to become positive. Now, he did mention that if we did the PCR test between days 4 and 7 and it was negative, but that person becomes symptomatic, either before that time frame or after, they still would need to be retested, because as he mentioned, that PCR test is only showing us one picture in time, and that picture can drastically change hours and minutes after exposure. The CDC does state that it does not matter if the PCR test is positive or negative while someone's under investigation. The person is still under home quarantine for 14 days. And this is, again, talking about a non-essential employee. So if we look at that, home isolation for 14 days and self-monitoring of symptoms needs to be done by your employee. They need to be able to raise their hand and say whenever they've started to develop symptoms and need to be under further investigation for potentially additional testing. But they definitely need to be home for 14 days to help prevent the spread. If they need to go out for any reason, they need to make sure that they have face covering on. They need to remain 6 feet socially distanced from everyone, including the people in their own home. This helps to protect their family members from potentially being exposed. The exception to all of these things with the 14-day quarantine comes down to if you have essential workers in your workforce. Essential workers can be a definition. It all goes based off of employer. It's specific to you as the employer. And what that means is that a person in your workforce that you can't do without. You can't run a production line without that particular employee. The guidelines are different. And that's something where we need to weigh the risk and benefit for that particular employee to your workforce. So I hope that makes you feel a little bit more comfortable with if and when you develop or have an exposure at your workplace. We're here to support you.
Nicolette, I'm going to ask one question, which you're not expecting, but I think it's probably a question folks are thinking about. In the case of essential workers, if they're symptomatic, so these are essential workers who were exposed and then become symptomatic, what is your recommendation, even if they are an essential worker?
Excellent. So if they are an essential worker and they have to return back to your workforce, first and foremost, Ruth, they should always be in face covering. So that could be a cloth mask. It could be your N95s if you have those. It could be surgical masks. So if they return to your work environment, they need to have face covering on at all times. So let's say they become symptomatic. At that point, they would have to be pulled from your workforce, period. And at that point, PCR tested and followed.
Thank you.
Absolutely.
So nobody who's symptomatic should be in the workplace, correct?
Absolutely not.
Okay. All right. Thank you. I'm going to close us out today and use the next few minutes, and then we'll do some questions and answers. Talking a little bit and providing an update to all of you on some capacity and capabilities that we have made available to you to try to help you. And so the very first request that we received from several of our employer partners were, can you help us with daily symptom checking of our employees? And the answer, of course, is yes. I know some companies are looking at a screening process, including temperature checking every day as people come into work. And I can tell you that we're fully supportive of that process, but having tried to operationalize it in one of our facilities where you have hundreds of people entering at the same time during shift changes or start of work for the day, can clog up a line pretty long when you're asking a set of questions that continues to grow, quite frankly, as we've learned additional symptoms of COVID. So we did put together a digital screening survey tool. It has the most up-to-date COVID-19 symptoms, and then we add to those as we learn more information. This is made available to you via a link or a QR code that you can then distribute to your employees. They can then complete the survey, which asks them the questions and then collates that information and provides it back to you on a daily basis, and you can pull that up in real time. It's an easy checker, and it does not track. So we do not keep the data. You would have access to the day-to-day data based on your saving the reports that we send to you. But really the question is, am I safe to go to work today? If you answer yes to any of the screening questions, we would automatically indicate that that individual should not report to work that day and then redirect them back, quite frankly, into our website to help them get screened and then tested if they needed to be tested. We're making that available free of charge. We want to be supportive of trying to protect our community. So if this is something that you would like to have us work with you on, please email us at covid19rtw@atriumhealth.org, and a member of the Employer Solutions team will reach out to you immediately and we'll get you set up as quickly as possible. The second work that we've been doing, and Nicolette did such a great job of explaining the best way to manage worksite exposures, is to provide a program that has guidance that would help you determine the level of exposures your employees have sustained, and then provides an ongoing monitoring of those identified employees until they meet the time frame to be cleared from work. So our clinical consulting team helps identify the individuals. We enroll them in a virtual process using telemedicine. We will refer those individuals for PCR testing between days 4 and 7, unless they have symptoms, and then we'll refer them as soon as they have symptoms. And then we will follow them to clearance, either 14 days if they're asymptomatic and negative, or until they're cleared based on their particular symptoms. Again, would love to work with all of you. I made a comment on another call that I think had a meaningful impact because I got a feedback from someone. It is not a matter of if you will have an exposure in the workplace. It's a question of when. And having a healthcare partner in place when that happens that you can rely on, I think, provides an opportunity to help you be successful in the management of that exposure. And we'd like to offer that to you. And then finally, because we believe that having a test that has high specificity and sensitivity from a reputable provider who also can answer questions about what it means to be antibody positive or not, we are offering on-site antibody testing services. We have one of the most reliable antibody testing platforms available currently. We're consistently reviewing new platform technologies as they come online. We will screen all of the individuals prior to testing to ensure that everyone remains safe. As Dr. McCurdy said, these tests are drawn by venipuncture. And so we will draw a tube of blood in order to do the test. And then the employee will receive their results personally, and then we'll ask them to consent to release that information to you so that you can use it in your planning as you're thinking about what to do when individuals come back to work. Again, if you have questions or want additional information on how Atrium Health might partner to help you during this time, please feel free to reach out to COVID-19 RTW at atriumhealth.org. And we will do our best to either help answer your questions, get answers to your questions, and quite frankly, if you have ideas or areas where you need additional help in this space, we'd love to talk to how we might be able to help you. If you're having those questions or issues or need help, there are probably other employers in the market that also need help. Our goal is to help reduce community-wide spread to a degree where it's manageable, so that we can continue to provide healthcare services for all patients across our footprint. So we'd really be open to partnering with you in any way that might be beneficial. So I'm gonna wrap up my part of talking, and I'm gonna ask Grady. Grady, are there any questions that have come through that we'd like to ask any of our esteemed panelists?
Yes, Ruth, there have been a few questions, and I would like to ask Nicolette to answer the first question that came through, and that is, if an employee is exposed in the workplace and is sent for testing, what type of reporting or paperwork can the employer expect back from a documentation perspective?
Great question. So if they're sent for testing, then initially what we'll have is a return to work statement based on what the risk of exposure was. So the plan is, from the time of exposure, there would be a return to work statement. And then at that point, you would be able to use that for your needs. And then at the end of the surveillance period of time, there would be another return to work statement. If it were to be a patient that becomes, or employee that becomes symptomatic, we would also provide guidance there from a return to work statement as well, which will be an electronic statement within our EMR. And that would give guidance as to when that person could return to work. When they become symptomatic, it's a different time frame. But yes, we would be providing return to work statements for both of those situations.
Perfect. Thank you so much, Nicolette. Really appreciate that answer. And Dr. McCurdy, the next answer, if you could help us with, or the next question, if you could help us with, is could you explain a little bit more about the difference between COVID-19 test for someone who's exposed versus the antibody test, and how those results may differ in returning someone to work?
Sure. So again, just to sort of lay out what each test means for the context. So the PCR test that we're doing is really looking for the virus itself. And so that typically would reflect viral replication. So we're using that test mostly for people who have symptoms, or people who, again, as we alluded to, who might have been exposed, to see if they have the virus at that time. So really, when we're trying to, again, and I don't like the word great clear to use, but when we're looking to clear someone, we're using those sorts of tests to identify if they have the virus at that moment. And then, as Nicolette just alluded to, there's sort of time frames around that of when someone can get back to work based on having the virus. The antibody test I would caution to use for return to work. And I think we want to think about the antibody test again. It's evolving as how we want to use it. But the antibody test really says, has someone been exposed to the virus or had the infection in the past? And so one thing it can't do is it can't give a time frame other than to say it's happened before. And again, if we think about antibodies developing, we know that they can start developing as early as a week, typically around 10 to 14 days after exposure. And so really the antibody tests are probably better used at this time to say, hey, did I have this exposure or infection in the past? So just given a scenario of when an antibody test might be appropriate, there have been people who I've encountered or gotten emails from that said, golly, the second week of March, when this thing was starting to hit Charlotte, I had this really weird illness. I went to see my doctor and they did the flu test and said the flu test was negative. At that point, I couldn't get a COVID test because it wasn't available, or when I called, for some reason, I couldn't get that test done. And I really do think that that's probably what I had. So in that situation, now in May, we could be able to look back and say, wow, it does sound like you had a cough, you had a fever, and you had some shortness of breath and your flu test was negative. So that might be a place where an antibody test can say, yes, you did have that infection back then, because it does look like you've got antibodies now to it. So I would think right now, as again, while we're still evolving, antibody testing to return to work probably isn't a test we would want to use to say when someone can go back to work. I think people are thinking about it, and I think we're all still trying to learn what it means. But if someone does have antibodies because they were exposed in March and now it's May and we're trying to see about them working, there might be some confidence to some degree that yes, you did have the infection. But I think back to one of the questions that Ruth brought up is, should that person really behave differently? And my advice would be no, that their behavior should be the same, meaning wearing masks when appropriate, hand hygiene, all the things that we talked about with social distancing. But there might be some ability to say, yes, what you did have 2 months ago was consistent with that virus, and it does look like, based on your antibody, that you were exposed at that time.
Great. Thank you so much for that answer. And the final question that we have that's come through today, I will pose to Nicolette. She touched on this just a little bit, but based on the some information that just recently came out from the CDC regarding the transmission of COVID-19 via touch, now suggesting that the likelihood of transmission is minimal. Should that change anything in terms of how we manage our hand hygiene and cleaning surfaces and high touch equipment?
Absolutely not. We really need to be very careful. We think we know this virus and we don't. So I think that the more cautious you could be, the better your situation. So you have to think also about, secretions from someone that could be on a tabletop surface. You don't know how long it's been there. And so I think we have to be very, very careful and cautious with this virus until we understand it more. Like Dr. McCurdy was saying, we're 5 months in, we're only at the very, very beginning of this and understanding what it means. So I think right now it's being as cautious as possible, cleaning all surfaces, and just making sure we're doing anything and everything that we can to protect our coworkers and our employees.
Great. Thank you, Nicolette. And that's all the questions that we have that have come in so far, Ruth.
Thanks, Grady. I appreciate you facilitating the question and answer. As always, we want to let you know that if you have questions, want additional information, want to connect to us, easy to go to the COVID-19 RTW at atriumhealth.org. We have people monitoring that website on a consistent basis, and we promise to get back to you quickly. It is our intent that we'll probably have a town hall part 4 in the next 2 weeks. As the environment continues to change, we want to bring timely, up-to-date, and new information to you. So please be on the lookout for another email invite, most probably in the next 2 weeks, to connect. In addition to that, we want to thank you for your time. The recording will be made available to all of you, and the Employer Solutions team will push an email out with the link so that you can share this recording with your teams, with your leadership, and with others that you know. So thank you for your time today. Please, we wish you a very safe holiday weekend. Please remind your employees that we are not off of our social distancing, hand washing, and face covering time frame, and we want them all to be well. So stay safe, stay well, and hopefully we'll be back together in 2 weeks to continue our conversation around COVID-19.